All right. And we are live. Good morning, everybody. Welcome to today's live expert session, Lupus and Lifestyle Medicine with Dr. Micah Yu. We're really glad that you could join us to kind of kick off our Lupus Awareness Month programming. Dr. Yu, if you don't already know him, you should. He's an integrative rheumatologist. He has a really unique expertise level, and he also has lived experience as an autoimmune patient. So today he'll be sharing a bit with us about lifestyle medicine and how that can help in lupus. And we'll kind of start the conversation around some of the kind of thoughts and strategies around that. And then we'll kind of open it up to live questions. So if you have any questions, just add them to the comments or shoot us a DM and we'll be sure to ask on your behalf. Dr. Yu, would you mind sharing just a little bit about us before you dive in? I mean, about you and your practice?
Yeah. So I'm Dr. Micah Yu. I'm a board certified integrative rheumatologist. So I'm board certified in not only rheumatology, but also in integrative medicine and internal medicine. I have a certification in functional medicine and lifestyle medicine as well. I practice in Newport Beach, California, but I do telemedicine. I see patients all over the US and sometimes I give consultations throughout the world as well. And I'm on social media on YouTube, TikTok, Instagram. So I'm very happy to give a talk today on lifestyle and integrated medicine and lupus.
Nice.
So should I share my screen
Yeah,
to get
go
started?
ahead.
Okay, great. Let's see if I can make this work here. All right, do you see my lupus slides?
Yes, we do. We
Okay,
see we see the whole setup in PowerPoint with the slides
okay.
on the left and in the middle.
All right, so do you see
Oh,
the whole
yep,
slide?
perfect.
Perfect, awesome.
Yep.
So this is lupus and lifestyle and integrated medicine. I'm giving a talk for Lupus LA today. I have nothing to disclose. So this is my training and career. I did a residency and rheumatology fellowship at Loma University. Then I went to University of Arizona's Integrated Medicine Fellowship. Then I got certified in lifestyle medicine, functional medicine, and then I got board certified in integrated medicine. I'm the owner of the Dr. Lifestyle Clinic, my private practice in Newport Beach, California, and I'm the founder of My Autoimmune MD online social media platform on education and autoimmune diseases such as lupus. What are the objectives of today's talk? It's going to examine what lifestyle and integrated medicine is and learn about the components of lifestyle and integrated medicine. We're going to be talking about nutrition, some herbs and supplements, sleep and exercise, mind-body medicine, and environmental medicine. So how do you get lupus and autoimmune diseases? Well, you have to have the genetics for it, and then you have to have the right environmental factors for it. Some patients, as you know, can get lupus at a very young age. Sometimes the genetics are stronger for that patient to get lupus, but other people get it at a much later age. And it could be a number of different factors, such as a very inflammatory diet, plus trauma, and other factors that we're going to examine today. So autoimmune disorders are on the rise. As of a couple years ago, based on a paper in the Lancet, a prestigious medical journal, autoimmune disorders are found to affect around 1 in 10 people. So that's quite a lot. And I assume that it's only risen since then. I don't think autoimmune diseases are going down anytime soon because of so many different factors that we're going to talk about today. What causes autoimmune diseases? Well, on the top left, we have prescription medications. As you know, you can get drug-induced lupus, drug-induced vasculitis as well. So prescription medications can sometimes contribute to autoimmune diseases. Other things are genetics, pollution, and environmental factors. Your gender, as you know, females get more autoimmune diseases than men generally. About 70 to 80% of autoimmune diseases are made up by women. So a woman, because of estrogen and other factors in the genetics, it does play a role in autoimmune diseases. On the bottom left, we have diet, and we're going to talk about diet and anti-inflammatory diets today. Stress does play a huge role with autoimmunity. Weight gain, being overweight, does play a role also with autoimmune diseases because when you have a lot of adipose tissue or fatty tissue, they are hormonally active and they do present with pro-inflammatory immune signals. The gut microbiome is also very important as well as infections. We know that infections and chronic infections can also contribute and trigger autoimmune diseases and flares as well. Let's talk about nutrition. So we're going to talk about nutrition and gut microbiome here. So your gut microbiome is affected by different factors. How you were born when your mother was pregnant. Were you born by C-section or were you born vaginally? Because when you're born through C-section, you get exposed to the microbiome of the hospital first, uh, versus the microbiome of your mother. And diet also plays a role with your microbiome, gender, genetics, infections, stress, and age as well, amongst other factors such as sleep and exercise. There are many factors that affect the microbiome. But your microbiome, when it is altered, it can increase the risk of autoimmune diseases. So when your gut microbiome is altered and something called dysbiosis, where the bad gut bugs are overwhelming your good gut bugs, it can increase the risk of autoimmune diseases, and we know that in rheumatology already. So some of the diseases that has been shown to have gut dysbiosis are lupus, ankylosing spondylitis, psoriatic arthritis, rheumatoid arthritis, Sjogren's, and vasculitis, amongst many other autoimmune diseases that are not in rheumatology, such as Hashimoto's thyroiditis, multiple sclerosis, even non-autoimmune disease such as diabetes, gout. We see gut dysbiosis in those patients as well. So many things can help improve the gut microbiome. But in this section, we're going to talk about nutrition specifically. So is there a best diet for rheumatology diseases and lupus? You've probably heard of the autoimmune protocol diet on the internet, carnivore diet, keto diet, vegan diet, also whole food plant-based diets, pescatarian diet, and vegetarian diet. Is there a best diet here that can kill all lupus patients? Well, I would say that yes, anti-inflammatory diets can be very powerful, but there is no one perfect diet out there. I personally have an autoimmune condition myself. I have autoimmune arthritis called spondyloarthritis. I personally went on a whole food plant-based diet to heal my own arthritis, and you can find my story all over the internet. And in my experience as a rheumatologist, I would say there's no one perfect diet. Vegan diet did help me with a whole food plant-based diet, but I would say that's not the case for everyone. So this is what you don't want to eat. You don't want to eat your Super Bowl foods. These are foods that we're addicted to, that I was addicted to before as well. Your chips, your cookies, your pastries, your pizzas, burgers. These are all very tasty foods that we all crave as Americans. But you don't want to eat it. It's very pro-inflammatory. It can flare your lupus. This is what you do want to focus on. These are called phytonutrients. These are all colors of the rainbow, red, purple, green, yellow. These are all very healthy foods. And phytonutrients are essentially nutrients in all these different vegetables and fruits and even beans that has anti-inflammatory effects amongst many other effects in the body. And these are two different food diagrams that are very evidence-based. The left side is from the Canada Food Guide. The government of Canada, when you look up Canada food recommendations, the government of Canada does show this diagram on the left. So this is what I tell my patients to start off with. It's very similar to a Mediterranean diet. So half the plate are your vegetables and fruits, a quarter of it is some protein of your choice, and the rest are whole grains. Now, the right side is from Eat Lancet. Lancet is a very prestigious journal. About 5 years ago, they came out with a food article on how to eat, essentially for human health and for also for environmental health as well. And very similar to the Canada Food Guide, half the diagram is fruits and vegetables, and you have whole grains that take up about a third of the diagram, and then some animal protein and very minimal sugars and plant oils. The American College of Lifestyle Medicine came out with something very similar as well, and they talk about half the plate is fruits and vegetables. They take out animal protein here. They're very pro-vegan in the American College of Lifestyle Medicine. But I would say the theme is very similar here. Protein, plant protein is a quarter of the plate, and whole grains another quarter of the plate. So they take out animal protein. I'll leave that up to you whether you want to add that in or not. But in general, fiber is emphasized in all these diagrams here. Fiber is essential to helping the gut microbiome and also for gut health. We know that fiber, dietary fiber, can help decrease inflammation and also build up the mucus lining of the gut as well, and can also help build up something called T regulatory cells. T regulatory cells are part of your immune system that is very important for improving inflammation. In lupus patients, amongst a lot of different autoimmune diseases, we actually have a depletion of T regulatory cells. So we want to build up T regulatory immune cells because they're anti-inflammatory. They help our immune tolerance. So they're very useful for also fighting viruses and bacteria as well. So the fiber intake on a daily basis should be 25 grams for women, 38 grams for men, and an average US citizens are only getting 15 grams a day. That's not enough. We need to aim for more. So what can you do to get fiber? Well, eat your fruits and vegetables, number one. You can get your whole grains, number two. And number three, you can eat your beans and nuts to get fiber. So those are all natural sources of fiber. I mean, you can certainly look into fiber powder. There's fiber supplements out there, but I always emphasize natural foods to my patients. Fiber does help with inflammation. So this is they looked at 20 years of data and Haynes. So they looked at metabolic syndrome, inflammation, obesity with dietary fiber. What they found that was that the more fiber a patient ate, the less metabolic syndrome, risk of metabolic syndrome the patient had, which is high blood pressure, high cholesterol, and diabetes. So they had less risk of that. They had less risk of inflammation as well. So the inflammatory markers went down as well. And the risk of obesity also went down with fiber intake. So fiber is really important for not only autoimmune diseases, but for general health as well. Fiber intake was looked at with knee pain in the American College of Rheumatology. The more fiber a patient ate, the less knee pain the patient had. So this is sort of a common theme if you look at a lot of different studies out there with rheumatology and autoimmune diseases. The disease activity of different autoimmune diseases does tend to improve more with more fiber intake in general. We talked about phytonutrients already. So these are all the different colors of the rainbow. I personally try to emphasize these foods in my daily intake as not only as a doctor, but also as a patient in rheumatology as well. I personally feel that these foods have kept me in remission and have kept me feeling healthy. And I get them naturally. I try to go for organic. I like to make green smoothies. I like to eat them naturally in salads as well. I try to get them organic as well. So if you can't get organic, you can still get non-organic. That's just as good, except that you might get some of the pesticides in them. Okay, but eating some of these is better than not eating them at all. Next, we're going to talk about omega-3 and omega-6 fatty acids. So omega-3 fatty acids are anti-inflammatory, and omega-6 fatty acids are generally pro-inflammatory. However, there are some omega-6s that are anti-inflammatory as well. So omega-6 fatty acids, you generally get them from a standard American diet, such as a lot of oils out there, a lot of processed meats, a lot of French fries, a lot of fried foods. These foods can increase omega-6 fatty acids. Omega-3 fatty acids you can get them from fish oil, algae oil. You can get them from different food sources, but generally from fish. Okay, but you can take them as a supplement as well. The reason why they're so important to talk about is because omega-3 and omega-6 fatty acids are generally competing against each other they compete against over the same enzymes, the same biochemical processes. So if you're eating a standard American diet and a lot of burgers and processed pastries, fried foods, you're gonna lower the amount of omega-3 fatty acids in your body because they're competing against each other for the same enzymes. So generally, I like to tell my patients try to eat more omega-3 fatty acids through supplements and through fish as well, and try to lessen the amount of omega-6 fatty acids in your body. And you can get labs to check for this. It's called the omega-3 checker in LabCorp, Quest, and other national labs as well. So you can check the ratio of your omega-3 to omega-6 fatty acids. I generally try to get my patients to aim for a 4-to-1 ratio. Standard American diet is generally a 20-to-1 ratio of omega-6 to omega-3 fatty acids. You want to get a 4-to-1 ratio as much as you can. Generally, my patients don't reach that, and that's okay as long as they get close to it. So I've seen 6-to-1, 8-to-1. I'm happy with that.
Mm.
Excess salt is inflammatory. So the New England Journal of Medicine has already talked about how a lot of salt can be pro-inflammatory. And this diagram shows that a lot of the drugs that we use in rheumatology today, um, they are competing against high salt. So when you eat a lot of salt, they are fighting against the same medications you're taking as a patient. So some of you might be familiar with some of these medications out there. These are all biologics we use in rheumatology. Some of you might be using tocilizumab or ustekinumab with lupus. Benlysta can also target some of these different pathways. It's a B cell fighter with Benlysta, but a lot of salt, over 2 grams generally, is very pro-inflammatory. So check the labels of your food. Make sure they don't have high salt. When you're eating out at a restaurant, it's very salty already. So I generally tell my waiter or waitress to not put salt on my food, and I'll just salt it myself. High salt can also exacerbate lupus nephritis per this study here. So these rats, when they gave the rats high salt, it increased the double-stranded DNA, which is the graph on the right here. HSD means high salt diet. Protein levels, urinary protein also went up as well. Lupus patients, you want low protein in the urine, you want low double-stranded DNA. Also, these inflammatory markers also went up with salty diet as well. The Western diet is very pro-inflammatory. It can lead to gut dysbiosis, as mentioned earlier. Sugars, artificial sweeteners, maybe, but we know that artificial sweeteners can alter the gut microbiome. Saturated fats can lead to gut dysbiosis and gut inflammation. Gluten potentially can do it too. High salt can do it. Omega-6 fatty acids can possibly do it as well. So you want to eat your omega-3 fatty acids as shown here. It can block and improve gut inflammation. You want to eat your phytonutrients, which I emphasized earlier as well, from your fruits and vegetables. And some about herbs and supplements. So turmeric is an excellent anti-inflammatory herb. I like it a lot. I take it myself. I like it around 2 grams a day, but definitely talk to your doctor whether it's safe for you to take it, because it can thin out the blood. It can also potentially, as a side effect, cause liver damage in some patients. Generally, most patients do fine with it, but if you're genetically susceptible and you don't process certain supplements well, turmeric can affect you in a adverse way. Turmeric is anti-inflammatory. It's been studied a lot. There's over 6,000 studies with turmeric. It can block these different pro-inflammatory markers. And I point these specific ones out because we have drugs in rheumatology to block them also. N-acetylcysteine is also anti-inflammatory as well. It's an antioxidant. I like to give it to my patients. In this study, it showed that in lupus patients, when you take 1.8 grams of N-acetylcysteine, also known as NAC, it can improve lupus disease activity over placebo. So I like to give NAC to a lot of my patients. It's pretty safe overall. Some of the side effects that I've seen in my patients, they said, oh, it gave me acid reflux. That's the worst thing that I've seen in my patients so far. I like to take it myself sometimes as well. It can help with flu-like symptoms. It's pretty good. It's generally pretty tolerable. Vitamin D is also anti-inflammatory as well. Vitamin D has been shown to be, when it's low in lupus patients, it can lead to more fatigue and potentially higher disease activity. I love vitamin D. It's in all our immune cells. And also when you have low vitamin D, it can lead to gut dysbiosis also. So please make sure you get your vitamin D to a normal level. So make sure you get your vitamin D checked by your rheumatologist. Other dietary supplements are fish oil as well. We talked about how beneficial fish is and fish oil is. 3 grams a day at a minimum dose is what I recommend to patients with different autoimmune diseases. Generally, I aim for 2 grams. I then go up to 3 grams. Side effects of too much of fish oil is potentially it can thin out the blood. So I tell my patients just watch out for bruising. Definitely stop it before your surgeries because you don't want to bleed out during surgery. So let your anesthesiologist and your surgeon know if you're taking this supplement along with turmeric as well. That's how sleep and exercise. So sleep is really important. It's anti-inflammatory. This study recently in the Journal of Lupus in 2019 showed that sleeping less than 7 hours a night can lead to higher risk of having lupus. Okay, so that's what the study showed. It said it didn't matter how you got those 7 hours, as long as if you slept less than 7 hours in general, they found more patients with lupus in that category versus those that slept more. So, I mean, I generally sleep around 7 hours. If I sleep 6, I work a lot. Um, I've been doing well with my own autoimmune condition. Even though I sleep around 6 and 7, I work a lot. So everyone's a little bit different, I would say. But generally, you don't want to pull all nighters. You don't want to stay up till 2 a.m. watching TV. Okay. I think the general guideline here is have a generally good routine where you sleep around 9 or 10 o'clock, and then you wake up at a reasonable hour. You don't try not to work graveyard shifts. It does alter the gut microbiome as well. So watch your sleep habits. And as far as exercise, it's anti-inflammatory. With lupus patients, you do want to do some form of exercise. I know some of us have high disease activity. Sometimes it's very hard to even get out of the bed. So what I would say to patients in those categories is just stretch, do some type of movement, chair yoga, restorative yoga. But if you're a patient that has a disease activity control, try to lift weights, build muscle. It's anti-inflammatory. We want to keep moving. So any type of movement is good on the body. Tai Chi is also excellent as well. We have studies with it with fibromyalgia and also osteoarthritis, as shown here. This is from the American College of Rheumatology. Osteoarthritis has Tai Chi as as a recommendation in their guidelines. I've done it myself. Um, I find it very useful. It helps with the core. It's very hard. It can burn your legs. It's very slow. It can be very boring for some of us out there, but it's very good for your health. Let's talk about mind-body medicine. So mind-body medicine is very important. A lot of us are very stressed. We're in sympathetic overdrive. So these are some of the ways to help with mind-body medicine. Deep breathing, yoga, mind stress-based reduction, clinical hypnosis, biofeedback, mindful eating, and guided imagery. I'm not going to detail with all these today, but I want you to know that there's options out there to help with mind-body medicine. Psychoneuroimmunology is another key piece of mind-body medicine as well. So you need to know that stress can affect the nervous system, which can also affect the immune system. Your doctor probably will never say this word to you, and this might be the first time you're hearing psychoneuroimmunology. But this in integrative medicine, we know all this is linked already. I talk about it all the time in my own practice. I link all this together. There's ways to help with this, with supplements, with mind-body medicine. There's so many ways to get around this. Medications generally don't work on this. You need integrative medicine to work on this piece of the puzzle. So the vagus nerve runs from the brain down the neck and connects your gut and your immune system. The vagus nerve is really important. Um, Deep breathing, some of these other things works on the vagus nerve. You want to focus and stimulate the vagus nerve because the vagus nerve drive our parasympathetic nervous system. So our parasympathetic nervous system is what we want to emphasize, and that's our rest and digest part of our nervous system. So a lot of us with autoimmune diseases and in lupus have sympathetic overdrive. We're in fight or flight mode. And that's driven by many factors, whether that's work stress, family stress, or we're just a very anxious person, or we've had trauma in the past that has stimulated our nervous system through the parasympathetic, through the sympathetic side. So we want to be aware that vagus nerve is really important, and working on the vagus nerve is very important as well. Let's briefly touch on environmental medicine. I'm not going to go into detail into this, but you need to know that this is very important, and doctors don't have trained this. You need to have integrated medicine training to understand this and learn about it. Um,
Mm.
so pesticide use can increase the risk of lupus and rheumatoid arthritis based on the study from the ACR, American College of Rheumatology. So studies have shown that when you work directly with pesticides, it can increase the risk of lupus and rheumatoid arthritis more so than someone that gets exposed indirectly some way, like if a gardener is spraying around the vicinity, or you go to a park that has pesticides sprayed all over it, you can have an increased risk of getting these diseases. But if you work directly in it, like you're on a farm and you're directly, your job is to spray it, your risk is much higher. But in general, you want to avoid these pesticides, okay? It's not healthy for us. And Nature Immunology, a very prestigious journal as well, has talked about environmental pollutants stimulating the immune system. So we want to avoid like pollution as much as we can. Get an air filter. Avoid um, tap water if you can. There's a lot of things we want to avoid. I don't have time to get into detail of this, but we want to avoid these things in general, kind of because it can stimulate the immune system and it can be pro-inflammatory. Just because you make all these changes doesn't mean that the next day your lupus will disappear. But I think in the long run, it'll be very beneficial for your lupus and your overall health. Because not only does it disrupt your immune system, but it'll disrupt um, your endocrine system as well. It will disrupt your hormonal system. That's why we see earlier um, menopause in females, or earlier menses in teenagers and young females, even earlier testosterone loss or low testosterone in men as well. We're having a big epidemic with the hormonal system. But I am coming out with my rheumatoid arthritis and autoimmune summit coming out next week on May 12th to May 18th. So if you're not watching this live, you're watching this after this symposium has been created, you still can watch the replays by going to the link here. So this summit is so important. I'm hosting it, I'm putting it together. There's 30 speakers, and the topics are all very important for lupus in general and autoimmune health. So I talk about hormones, the gut microbiome, gut health, nutrition, what diet to eat. I talk about mind body medicine, trauma, stress. I talk about environmental toxins and how that can affect your immune system. I talk about that with another rheumatologist actually. I talk about mold. Some of you might be very interested in mold and mycotoxins. I talk about that as well. And I also talk about Lyme disease and tick-borne infections as well. So if you have lupus, you're interested in integrative medicine, you will be very interested in these topics, because these topics we don't talk about in rheumatology. You don't really talk about these with your regular rheumatologist. So please go to this summit. It's 7 days long. It's 30 speakers with a lot of content, and you can always watch the replays afterwards by going to the link.
Awesome.
Yeah,
Thank
thank
you.
you.
Of course, I'm going to link to the summit in the comments and in the captions. So if you're watching this, you can head over there to check out their link to register. Thank you so much for this, Dr. Yu. I feel like there's
Or
just so many different factors when looking at lupus or any autoimmune situation from this lens, and it can be a little bit overwhelming. So this is so helpful to kind of break down some of the main areas that might help support a patient who hasn't maybe addressed looking at their situation through, is their vitamin D low, or where is their omega-3, omega-6 ratio at
right.
right now? It can be really helpful to think of some of these other ways to kind of optimize your lifestyle, to see if that can support your treatment plan. Obviously, talk to your doctor about what works for you, specifically in your case. But do you have time for just a few quick questions, Dr. Yu?
Yeah, before we get to the questions, I just want to
Sure.
mention I'm on social media on YouTube. My Autoimmune MD is my social media handle. I'm on YouTube, Facebook, Instagram, and TikTok. And if you want to make an appointment with me, I'm at drlifestyle.org, drlifestyle.org. And if you go to myautoimmunemd.com, I have a lot of information and free information on lupus and other topics that we just talked about today. That's my personal website. And my email, that I don't manage, my assistant does, is contact@myautoimmunemd.com.
Nice. Thank you so much.
Of course. Yeah, I'm here for questions as well.
Great. We have someone asking from the nutrition section of your deck, talking about like the phytonutrients and kind of eating the rainbow. Are there certain foods that lupus patients should avoid or be careful with? Like I think they're probably asking about like garlic and nightshades, I'm guessing.
Yeah, so alpha sprouts, I've heard that there's some studies out there that can affect lupus. I've
Oh,
personally not seen that in my own patients. Other things are nightshades. Nightshades, I generally don't tell patients to avoid them.
okay.
The science is very weak, but I have seen patients it affect their give them more brain fog or arthritis.
Mm.
Um, and what was the other question regarding nutrition?
I think they're asking about like garlic and nightshades, but I don't know if
Oh,
garlic is if you find in your practice that
I don't
there's
tell patients
anything.
yeah, I don't tell patients to avoid garlic. I tell them if you notice a personal problem with it, then avoid it. But in
Mhm.
general, I don't tell patients to avoid garlic. But I don't tell them to emphasize garlic either. So I just tell them if it's in your food, don't be scared of it.
Yeah. Okay. That makes sense. And then,
Mhm.
do you ever have a philosophy for autoimmune patients around intermittent fasting, or is that just really patient specific?
Yeah, I do recommend intermittent fasting, 12 on, 12 off, or 16 on, 16 off, 8 on. So eating for 8 hours a day, and don't eat for 16 hours. I think fasting is very anti-inflammatory. I'm actually coming out with a coaching program that's going to talk about all this stuff. I talk about intermittent fasting, I talk about diet,
Wow.
and after they watch the summit, they can get access to that.
Nice. Okay. And then if someone was newly diagnosed, what are kind of like the first few bite-sized things that if someone is not really in the world of more integrative
Yeah.
medicine, that if you had a lupus patient that was newly diagnosed, that you think might be specifically helpful for that out of everything you talked about
Yeah.
today?
Yeah, I would say just make sure you don't eat the standard American diet.
Mm,
Something that's a lot of doctors and everyone would agree is that Mediterranean diet is a good start for a healthy diet, and that's also anti-inflammatory as well.
nice. And then when it comes to exercise, yeah, I'm looking at
Um,
the questions. When it comes to exercise, if you do have like a really high pain day, are there situations where like you would recommend a patient hold off on movement? I know you mentioned chair yoga.
yeah.
Would you say that that's kind of what the recommendation would be in general?
Yeah, chair yoga, just stretching. Maybe it's a day that you shouldn't do much exercise, and that's okay. You got to listen to your own body's cadence and rhythm. So if you're flaring that day, just stretch at home, do some um, chair yoga or something, because stretching is also very important.
Yeah. Um, since you're an autoimmune patient, what has helped you the most personally? I think you answered this already in your deck
Yeah,
around diet.
I think when I was flaring a lot, I would eat a generally healthy diet per se,
Hmm.
but not an autoimmune healthy diet. So I think going a whole food plant-based diet helped me a lot. That put me to remission. And then just maintaining that has been like exercise. So I do weights, I do high intensity training too, and I don't flare after that. So just having a positive outlook. So I have a mission. I told myself I'm going to heal myself no matter what. I have a mission in life to help autoimmune patients. So I have something to look forward to every day. I love my work. So just even though I work a lot, I don't find it stressful. So I think minimizing the stress through mind body medicine can be useful. I do that through exercise and having a good
Wow.
community like friends and family to be around.
Wow, that's really neat. Awesome. Well, thank you so much for your time, Dr. Yu. For
Of
everyone
course.
listening, we'll link Dr. Yu's contacts, his socials, and also the link to the summit so that you can sign up. And then if you are interested in talks like this, stay tuned. This month, we're going to have a lot more programming that's free for the lupus community. So just stay tuned. And thank you for joining us.
All right. Thank you so much, Lupus LA.